Have you ever wondered if some of our well-meaning approaches to improving kids' health may actually be doing more harm than good? My team and I recently conducted a systematic review examining whether some well-intended school-based policies around health and nutrition that aim to promote health might actually have unintended negative consequences for kids. We examined almost 2,000 studies and narrowed it down to just 11 that focused just on unintended consequences of these policies, such as body image concerns, financial losses, or parent concerns. The first thing is that we expected unintended consequences to be studied much more often than they actually are. The second thing we noted was a blurry line between what the interventions intended to do versus when it went too far. For example, some studies noted that teens took in fewer calories throughout the day after engaging in these interventions. Although that may be what was intended, it's hard to tell if those changes in caloric intake are related to choosing healthier foods or something more insidious, like an increase in disordered, overly restrictive eating, which some folks have worried about. These findings highlight something really important to consider. We're often designing interventions and rolling out policies that are trying to make kids healthier, but systematically, we aren't doing a very good job of ensuring that's the outcome. We can't quite say that these types of policies are totally beneficial or totally harmful at this point. We need more evidence. So we hope that our findings will help researchers to consider evaluating potential unintended consequences of public health initiatives in the research. This is a key step to making sure our efforts are being used most effectively. And simultaneously, we hope that those who are developing these programs, like policymakers, local officials, or even researchers, invite people to the table who may be able to shine a light on things we're not thinking of. If we design health interventions with the real world in mind and invest in a holistic evaluation of these interventions, we can be sure that our efforts, time, and funding are improving kids' lives and not causing harm.